Hi, I'm Mary Sue Lynch with Lynch Training and Consulting. My job with Lynch Training and Consulting is to help healthcare organizations with their healthcare training, human resource training, things of that nature. So I'm here today to talk with you about worker rights. Just as patients have rights, nursing assistants also have the right to work in a safe and positive environment. In this lesson, we'll be talking about your rights. We'll also be talking about job responsibilities, environmental safety, which is really important, harassment, as well as care for you, the caregiver. The goal, if you think about it, is to provide quality patient care in tandem alongside with worker rights, preserving the needs of both. While caregiver training focuses on skills and competencies for providing care to patients, it's important to touch on your rights as well, so we'll be doing that in this lesson. First of all, I want to talk with you about the law, specifically the federal law, and it's important that you understand the federal law because they do impact you. They're important because of the following four reasons, so keep this in mind. First of all, federal laws are important because they act as the basis of programs which act as a source of payment for your employer. That directly impacts you. So the laws do drive the programs which drive how you are paid. Also, it's important to know that the laws impact your paycheck in the form of deductions. It's your money that's helping to pay for services that are related to laws. Don't you want your money used as wisely as possible? Third of all, the laws involve regulations that govern what your employer can and cannot do. And then finally, laws protect both the caregiver as well as your client, your patient. So the laws are extremely important and do impact your worker rights. Now, there are a few laws that are important to discuss in this lesson. First of all, I want to take you through the Older Americans Act of 1965. You may have heard of folks refer to the COP program or the Community Options Program. This is a program that allows funding for services for seniors. Some examples would be home health care, transportation. You may have heard about a Meals on Wheels program. Oftentimes this is funded through the COP program or the Older Americans Act of 1965. The Social Security Act of 1965 is also important for you to know with regard to federal laws. There are two pieces to the Social Security Act that I want you to be aware of specifically. First is Medicare. Secondly, Medicaid. Let me touch on Medicare first of all. Medicare provides medical insurance for persons 65 and older. You probably see this deduction on a paycheck stub because a deduction is taken out of your paycheck. Medicaid, in contrast, pays for health care costs for any person, not just senior citizens, but any person who is without medical insurance. And this comes out of income taxes that you'll pay. So do keep in mind the Older Americans Act of 1965 and as well as the Social Security Act of 1965 and how they impact you. Now, there are other federal laws in place to protect you. For example, the Workers' Compensation Act, the Occupational Safety and Health Act, the Controlled Substances Act, and the Omnibus Budget Reconciliation Act. Now, I will cover those things just a bit later on in this lesson. What I want to talk about now is your roles and responsibilities. Now, keep in mind that your job day to day can be extremely stressful, and if you put on top of the stress of your job the confusion around your role and responsibilities that can sometimes occur, it's important to know some things so that you can be more comfortable and able within your position as the caregiver. Here are some things you'll want to keep in mind. First of all, I think a gold mine of information is to be found within the job description. What you will find in the job description is not only the reporting structure, but also the line of authority. And so in your role as a nursing assistant, you will be reporting to a nurse. You'll also find in your job description general and specific job duties, so you can know what's expected of you in your position. Restrictions and essential functions of the job can also be found in the job description. And essential functions, just to explain to you, are things that anyone that would be hired into your position would be able to do. So that's real key to look at, to see what would be expected of you and what is expected of anyone that would be hired into a caregiver position. Fourth of all, your job description gives you a snapshot of the types of things that you'll be doing in your job and you will be responsible for doing. And then finally, the job description indicates who you report to. What I usually say to most folks that are interviewing for positions in healthcare is, when you come into the interview, ask for the job description. You'll find a wealth of information in there, and it gives you a good sense of what your job will be like day to day. Now, in addition to the job description, your role and responsibilities are limited to some degree based on what your background is. For example, there are certain nursing acts and other laws that allow but also restrict you to do certain things and allow and restrict others to do things. One example that I can give you straight off is the Controlled Substance Act. You may have heard of that act. What that act does is it regulates the use of controlled substances like narcotics, other addictive drugs, and outlines who can give them. Specifically, a registered nurse or a licensed practical nurse, an LPN, would be doing that. So that would be something you would not be allowed as a nursing assistant to do, and you should know that it's your responsibility to follow this law. The Omnibus Budget Reconciliation Act of 1987 sets some specific regulations of what you can do as a nursing assistant. First of all, they set standards. So they manage the rules and regulations around nursing assistants. Why do this? Consistency. And make sure that all of us are doing things according to a set standard. Secondly, the Department of Health and Family Services oversees nursing assistant training. So they manage the training that you receive to become a nursing assistant, again, to make sure that there's consistency of quality. We've talked about your role and responsibilities, we've talked about the job description, and we've also talked about some things that you can and cannot do. I want to go back to the job for just a moment and talk about, once you're hired on board, what your right is. And one of your rights is orientation. And when you are hired in by a facility, they should be providing you with basic information and training on the facility, and so that you can become accustomed to the facility. In fact, that's a great question to ask a facility. Tell me about my training and my orientation. If there's not any, that's cause for concern, because again, it's your right to know what's expected of you. If you don't know, you can't do. Orientations often include general information as well as specific information, general information being the facility, where the bathrooms are, where the time clock is. Specific job responsibilities, what is a nursing assistant would be responsible for doing, for example, on PMs when they first check in. So in that orientation, you'd be covering both of those pieces. Now, most facilities do have probationary or training periods that are planned for the nursing assistant to be oriented to the particulars of the facility. So if you have questions, it's your responsibility to speak up during this time and get those questions or the additional training you need taken care of. If you are asked to do a task you're unfamiliar with, keep this in mind during orientation. Tasks that you'll be asked to do should be covered during orientation. If not, it's your responsibility to speak up and inform the nurse of this so that she can help you or he can help you. And you should be doing this under the nurse's supervision. So if you don't know, there should be someone to train you so that you can do it and you do know. What I'd like to talk about next is policies and procedures. Policies and procedures are tied very directly to your role and responsibilities. Policies are the position of the organization. It's generally what you can or cannot do. Procedures, if you think about it in simplistic terms, are the how something should be done. So it is your responsibility to know these policies and procedures, and again, these procedures and policies are based on laws and regulations, but also specifics of the facility in which you work. Policies protect both you and your patient. And they're outlined in specific statements. Let me give you a few examples. No bad-mouthing of other staff. That would be an example of a policy. It's an expectation that everybody's asked to adhere to. Some other examples of policies, maybe there's policies that are in place that encourage staff to assist new staff in feeling welcome. Again, that would be important. Complaining, perhaps there's policies in place within your facility that curb complaining. And it's your responsibility to go either to someone that can help you or to bite your tongue when we talk about complaining, because it happens in the workplace. Bottom line is preserving your right to a supportive work environment. And policies and procedures do just that. Procedures, in contrast to policies, as I mentioned before, specify how you do something, how actions are carried out. And they're developed not because everyone wants you to do things exactly the same as them, but because the outcome, the end result, is dependent on the how you do it. Your facility, for example, may have a procedure with regard to call-ins, and procedures set then the expectations for all. With the example of call-ins, perhaps everyone has to call in within 4 hours before the start of their shift. You can imagine what would happen if there wasn't a procedure around how to go about a call-in. And if you think about it, procedures also protect your rights. In the case I just gave you, the example of call-ins, they protect your right for adequate staffing. So it's important and it does benefit you, but it's your right to know policies and procedures and also your responsibility to follow them. Why? As I've mentioned before, consistency of quality of care. If everyone's using similar tools, they can respond in a similar way. Secondly, a benefit of policies and procedures is safety of the patients and safety of the staff. Injuries can occur. For example, if you're not following the proper procedure for lifting, it can result in an injury to one of the staff members. So when you are employed, it's your right to know the policies and procedures. It is your right to know what is expected of you and then to follow them. Finally, I can't stress something that a lot of caregivers fail to ask about during the orientation. And this, again, is your right and your responsibility, a performance appraisal. You have the right and the responsibility to find out how you're doing and to get feedback from your supervisor. Keep in mind that performance appraisals are oftentimes tied to your raises. So usually you do receive a performance appraisal after your training period and then on an annual time frame, yearly, usually at your anniversary. And it's your right and responsibility to ask for this. It's also important, however, to look at feedback not only during that once-a-year performance appraisal time, but ongoing. Feel free to go to your supervisor and say, how am I doing? You should be working with your supervisor to make sure you're doing what's expected of you. In addition to your role and responsibilities, one of your rights is to a physically safe work environment. The Occupational Safety and Health Administration, OSHA, put together the Occupational Safety and Health Act. And OSHA is responsible for putting together regulations, policies, and procedures that protect you. They address things like physical hazards. For example, the Federal Hazard Communication Standard was enacted in 1983 to take an approach to chemicals and for staff and employees to know about chemicals within the workplace and the precautions they need to take when they're working with the chemicals. You may have heard of a Right to Know program, and that's oftentimes what you'll find in your facility it's called. And the Right to Know program requires employers who use hazardous chemicals to prepare an inventory and to put together some training information sheets on those specific chemicals, then to train you on those chemicals so that they're labeled, so you understand, so all the pieces are in place so that hazards are being communicated to you. Your facility has information on chemicals being used in their facility. It's important for you to ask for that. Oftentimes in the orientation period, the facility will review that with you. Bloodborne pathogens is also something I'd like to spend a moment talking about. As you know, we work in healthcare, and in healthcare there are a lot of exposure issues. In fact, 5.6 million workers in healthcare are at risk of occupational exposure to bloodborne pathogens. HIV, hepatitis B, hepatitis C. Those are some examples of bloodborne pathogens, or things that can be carried through fluids. And the bloodborne pathogen standard addresses this issue. The ultimate goal of OSHA's bloodborne pathogen standard is to protect all workers from occupationally acquired bloodborne infections. This policy requires employers to conduct a job hazard analysis and to document policies and procedures that may be associated with a potential risk. You may have heard of the SHARPS program, and oftentimes within facilities they'll spend a lot of time talking about the SHARPS program. That's an excellent example. It's the Needle Stick Safety Program, the SHARPS program. Your facility will have specific policies and procedures around needle handling, and training will cover that so that you can be safe, so you are protected against bloodborne pathogens. OSHA has also developed the Personal Protective Equipment Standard, or the PPE. One example of personal protective equipment are vinyl gloves. And in your facility, you'll be asked to wear them when you're giving care to a patient. Another example would be a face mask, or perhaps goggles, depending on what you're doing. Again, all of these things will provide barriers between you and the person you're providing care to. Perhaps you've heard of other caregivers hurting their back while lifting a resident, or being bitten, or something happening while on the job. Well, OSHA's response to this was the Workers' Compensation Act. And the Workers' Compensation Act was enacted so that there were laws against injury and protecting against injury within the workplace. So if that happens, it is your responsibility. If you are injured, it is your responsibility to report this immediately to your supervisor, so that the supervisor can follow the procedures for your facility in taking care of this, reporting this information, and managing the situation. Of course, it's to your best interest to make sure that you are working safely. How do you do this? Following the policies and procedures of your workplace. For example, if you fail to use a gate belt, or a coworker of yours fails to use a gate belt, you can imagine the consequences. Someone can become hurt, perhaps you or your coworker. Can you imagine the impact on staffing this has? The best way to keep everybody safe, again, is to follow the policies and procedures. Security is also something that you should be aware of within your facility, and that security systems are set up to protect you and the patient. Perhaps it's frustrating to swipe a card or to punch in a code, but then again, this is done to protect you as well as your resident. So be aware that there are specific procedures, and be sure to ask why if you're not sure around security. They're for your protection. Now, we've talked a little bit about your rights. I also want to talk about the rights of your coworkers, and working with others is the next thing I'd like to cover. In your facility, everybody has rights. One of those rights is for people to be different, for there to be diversity in the workplace, cultural diversity. You will experience people from all different walks of life. They may be different ages, they may speak a different language, they may be a different gender, perhaps even a different race. Keep in mind that, like you, they want to be treated with respect and dignity, and should be treated as such. There are laws in your facility that protect against discrimination and hold you as well as others to this standard. In the same vein, harassment of others because of their cultural differences will not be tolerated. Such behavior has no place in our workplace, and it hurts people, it hurts morale, hurts staffing, and eventually it hurts the care we provide to our residents. The American with Disabilities Act of 1990, or the ADA, affirms the rights of persons with disabilities to equal access to employment, services, and facilities available to the public. This legislation is a comprehensive mandate for barring discrimination against persons with disabilities, and it provides enforceable standards. So the ADA requires that an employer provide reasonable accommodation for disabled individuals. Examples would include the altering of a facility. Again, keep in mind that in that job description, I mentioned essential job duties. If there's something that can be adjusted that will allow this individual to work within the environment, the facility will do all that it can. And that's the American with Disability Act's role, to make sure that if it's non-essential or if it can be adjusted, that it is, so that everyone who's capable of performing the essential function of the job have the opportunity to do so. Now, when working with others, the importance in you being your best and they being their best is key. And drug testing at the time of employment, or even during employment, is one way of making sure that everybody's working in a safe manner. And human resources will oftentimes have in the policies and procedures around drug testing. But if a worker is suspected of being impaired due to illegal use of drugs or alcohol, the facility may take action. And that's something you should expect. And again, it's to protect everybody's right. Talk with your supervisor or your human resource department for more information. Also, something to be aware of is everyone has challenges in daily life, and there are programs that are offered within many facilities that are free of charge. You may have heard of the EAP, or the Employee Assistance Program. Now, this is a program that you might find helpful for discussing such things as family issues. Perhaps there's drug and alcohol issues. Psychological issues could be for yourself, it could be for your family members. You can certainly touch base with your human resources area or your supervisor for your EAP contact, but this is a great resource. What's so key, because I know of many people that have used this service, is that no one will know, other than those you tell, that you've used this service. So we're all stressed day in and day out within our jobs. This is a nice resource for you to know about, since it's not reported to your facility. It is your right to be free of harassment and abuse in the workplace. So regardless of who you are, be it a patient, a resident, a staff member, your rights remain. There are a couple of things I want to share with you around harassment and abuse so that you can be informed. The Civil Rights Act of 1964 defines sexual harassment in the workplace, and it not only involves unwelcome sexual advances or requests for sexual favors, but contact of a sexual nature if submission is either an actual or implied condition of employment. If submission or rejection is used as a basis for making employment-related decisions, or the conduct interferes with work performance or creates an offensive work environment. Perhaps you have heard others talk of abuse by a client or a coworker. Harassment is a form of abuse. Now, here are some examples. Pictures, calendars, offensively sexually related language, indecent exposure, offensive touching. Your facility will have procedures around these things, whom to go to, what steps to follow. You have a right to work in a harassment-free environment, but it's also your responsibility to take the steps that you need to take according to the policies and procedures of your facility. Keep in mind, it's tempting when things are happening to gossip or to talk to somebody else about it. Gossip and complaining will not resolve an issue around something like this. Follow the procedures laid out by your facility and bring your concerns forward so that it can be taken care of. If they don't know, they can't help. To wrap things up in this lesson, I'd like to talk last about giving care to the caregiver, giving care to yourself. There are some things that you can do. This job is stressful. It can be demanding. You give a lot, you need to give back to yourself the best that you can. Take care of yourself. If you recognize things that cause you stress or upset, make sure you take that information forward. That's the first rule. Again, like said before, if they don't know, they can't help you. If you have personal conflicts with others, do something about it if you can't let it go. It's true, you don't always have to like everybody that you work with, but you do have to work with them. Here are some ideas. Talk with the person in a private place out of earshot of others. That'll put them not on the defense, and that'll keep things solution focused. If you can't resolve it, you may want to ask a supervisor for advice. Maybe ask them to mediate the discussion. There are also some coping mechanisms you can do to take care of yourself. One of them is time management. Are you scheduling time for you? Something that I would oftentimes do is turn off the radio and take my drive home from work as my time. Scheduling 10 minutes of downtime for you can be enough to help you process your work and then put it aside. In fact, my imagination would be that once I got home, I would take all those problems, imagine them as balloons, and let them go and say, that's my ground rules. I'm home, no more thinking about it. Home support systems, speaking of home, can be helpful. Perhaps there's someone you can talk to about your stressors or concerns at home. So if that works for you, do it. Maybe set aside check-in time. I know of another staff member who says at 9 o'clock at night, once the kids are in bed, that she has 10 minutes to talk to her spouse or significant other about her day. They have that time, and she knows she has a place to discuss her workday and someone to do it with. And don't forget that your fellow workers have some of the same stressors. Reach out to them at breaks. Maybe they have ideas, and I always say, if you go to a colleague or you go to a coworker, make sure you go to them with, I either want to just talk about it or I'm looking for a solution. Let them know what you'd like from them, and oftentimes they have great ideas for you. To summarize, in this lesson, we've talked about your rights as the caregiver. We've talked about what you can do, what you need to know, and how to act to provide care for yourself, as well as to do what's best for your patients. Your job is to be familiar with your rights and handle any concerns you have in a proactive and positive manner.